Infertility. According to the Center for Disease Control, nearly 6 million American couples have trouble getting pregnant or staying pregnant. And it's not just a woman's problem. Nearly one half of infertility issues can be traced directly to the man. To discuss this topic this morning, we have Dr. Don Evenson, an internationally recognized expert in infertility, and Dr. Michael Jacobs, a noted infertility expert from Miami, Florida. Good morning, doctor.
Morning, Olga.
Thank you so much for joining us, Dr. Jacobs.
Thank you.
Dr. Evenson, let me start with you. Let's start talking about your professional journey in this medical field, if you don't mind.
Yes, some years ago when I was on the faculty of Memorial Sloan Kettering Cancer Center in New York City, I was challenged with the question of, is it possible for us to measure the potential amount of DNA damage in sperm for guys undergoing chemotherapy? And as you know, chemotherapy agents can break DNA, and so this is what we found, and that project was very successful.
And you've done so much with that, and we're going to talk about that in just a few moments. Dr. Jacobs, your history as well?
I'm a specialist in reproductive endocrinology and fertility, a medical director of the Fertility and IVF Center in Miami, and we've been treating couples here in South Florida for 22 years now, both men and women, that have difficulty conceiving or maintaining pregnancies.
Can you tell me what sperm DNA fragmentation is, and give me the layman version?
Well, if you look at a DNA molecule, it's its double helix, so these two strands of genetic material that are intertwined together. And when you have breaks in the structure, the integrity of the DNA is not normal. And in simple terms, if the DNA is not structurally intact, the genes that are related to coding for fertility and that are responsible for helping maintain an embryo in early development aren't functioning properly. So the signals aren't being processed, and so either patients have trouble getting pregnant or staying pregnant.
But we've come a long way, I have to say, and there's so much hope out there for couples today. Dr. Evenson, let me ask you, what do the letters, and I'm reading it here, SCSA in your company stand for?
Well, the S is for sperm.
Okay.
And then C is for chromatin. Chromatin is where the proteins are wrapped around the DNA to protect the DNA, and that's structure. And then S is for structure. It's important that the structure of the proteins and the DNA are correct, otherwise you don't get a proper readout of the genes that are necessary for embryo growth, and the embryo may die. And then A is simply assay or test.
Okay. Now, I'm going to be completely honest. My husband and I actually had problems getting pregnant, and I don't want to say the problem, but it was the issues that I had, and I took some infertility pills as well, and we have two beautiful girls today because of all the help that we got along the way. How often, if I can ask, is infertility traced back to problems with men, and specifically their sperm? Dr. Evenson?
Basically, it boils down to about 1 in 5 men have this problem who come to an infertility clinic. There are some dramatic examples, however. For example, we did a study in Teplice, Czech Republic, where there's heavy pollution and there's a high level of infertility and miscarriages, and we found that the pollution level was responsible for breaking the DNA in the sperm of those men.
And Dr. Jacobs, you and I were talking about this a few minutes before we started talking right now on the show, about how way back when it kind of had the stigma of being the woman that had the problem, but not so.
It's about 40% of the time it's going to be a male factor, 40% a female factor, and the rest are going to be a mixture of both or just unexplained. So it becomes very, very important to test the man, and there are a couple of different clinical ways to do that.
And can you talk to me about some external factors that kind of make the sperm ineffective when it comes to men?
Well, environmental factors, things that people can have some control over, heavy smoking, use of drugs, exposure to bad environmental agents. If you're a landscape, you're involved with pesticides and so forth. Those are things that you can sort of take precautionary measures to try and avoid. Some things that you can't. If you have an anatomic lesion, such as a dilated vein in the testicle known as a varicocele, if you were born with an undescended testes called cryptorchidism that had to be corrected, if you needed chemotherapy because you were treated for some kind of cancer, if you have hypertension and you're on medications, all of these things have been associated with increased breaks in the DNA and increased levels of fragmentation.
But like I said, there's a lot of hope, so stay right there, gentlemen, if you will, because when we come back, how the SCSA test, called the gold standard for sperm DNA fragmentation screening, is helping couples suffering from infertility. Don't go away. We'll be right back. Welcome back, everyone. We've been talking with Dr. Don Evenson, President and Director of SCSA Diagnostics, and Dr. Michael Jacobs from the Fertility and IVF Center of Miami, both leading experts in the field of human infertility. Dr. Evenson, let me start with you. First, explain to me what this sperm DNA test and the process involved to get it done.
The patient can simply go to like infertility clinic and present the semen sample. That sample is then frozen and sent to our diagnostic center. We then thaw the sample, we treat it with specific chemicals and a dye that stains normal DNA green and abnormal broken DNA red. Then we run it through a computer that then measures 5,000 sperm per sample. And it shows exactly the amount of DNA break in the sperm and what percentage of the sperm are broken.
Dr. Jacobs, tell me some advantages of having this test as opposed to other tests.
Well, it complements what we already do. The issue is that a man can have a totally normal semen analysis, traditional count, motility, morphology. How many are there? Do they move? Are they normal in shape? And have very abnormal fragmentation in the DNA. And if you don't look at that, you're not going to get a full picture of the potential of that man to fertilize his wife's eggs.
I can only imagine that the couples that have come to both of you, when you see that family and you can make that difference, doctor, I can only imagine the fulfillment you feel. Do you have a story that you'd like to share with us? Because I always like to end on a high note.
We did a large study in Canada where there were 13 couples that had a idiopathic or unexplained infertility for years. These men had more than a 30% threshold of fragmentation. These couples then volunteered to do a donor sperm, and it turned out that 11 of the 13 couples were pregnant within 3 months. It certainly showed that the major factor here was probably the man's sperm DNA fragmentation.
11 out of the 13.
Yeah.
What a fabulous success story. Dr. Jacobs, do you have one?
Well, we had a couple that came to us with unexplained infertility, had been through multiple treatments elsewhere, including IVF that was unsuccessful with not good quality embryos. And they never had a DNA fragmentation test. We did the test, found out it was abnormal. We're able to treat the couple with, the man particularly, with antioxidants and vitamin therapy. And after 3 months, his values became more normal. We then did IVF with the injection of the egg, and they had beautiful embryos and now have a baby.
That's awesome. So for anybody out there, Dr. Jacobs, that maybe has said, oh, forget it, it's not going to happen, what would you say?
Never give up hope. There's tremendous means of treating people, tremendous opportunity to have a family, and to seek out a specialist that can do the appropriate evaluation and guide your treatment to end up with a happy outcome.
Doctor, thank you so much for what you're doing.
Thank you.
Really appreciate it, Dr. Jacobs. Thanks for being here. And if you'd like to learn more about this morning's topic, visit us at thebalancingact.com or get social. Join us on Facebook /The Balancing Act Fans.